Well, hello, and how are you both?
Well, thank you.
Doing great. Thanks.
Well, that's good. So, you're here for your regular check in today, is that right?
Yep.
Yeah, that's right.
So, Robert, how's your health been?
So far, so good. No problems here. Doing well. I'm happy. Still sober. And no drug use. All good.
Well, that's great. And I think you have been tested for hepatitis C since your last visit, is that right?
Yes. And it was negative. Thank goodness.
Wait, hold on a second. I don't know very much about hepatitis C, except that it's a virus, right?
Yes, it's a virus. Sort of like HIV.
Would you mind telling me more about it?
Certainly, I'd be happy to explain. Hepatitis C, also known as simply Hep C, is a virus that is unique in that it's slow acting. You might say that it likes to hide out in the liver, and that can have very serious consequences.
Why is it a big deal?
The liver is important for keeping our body healthy by processing everything that we eat or drink, including processing medications. Now, it keeps chemicals and waste from building up over time in our blood. If the liver isn't functioning properly, it can lead to serious and possibly irreversible health issues over a period of time.
Yep, that's right. So when Hep C gets in the liver cells, the liver stops working as well. This causes health problems over time because it causes inflammation that can lead to scarring and possibly death.
Yes, Robert's correct. If the liver stops functioning, as I mentioned, you can develop several secondary problems, such as weight gain due to water retention, severe abdominal pain, or severe bleeding. Jaundice has been known to develop, which is the yellowing of the skin in the eyes, and there are countless other issues as well that can develop when that liver isn't functioning.
Yes, and it can cause liver cancer too. But it doesn't happen immediately. It takes years to get there. So it progresses slowly, but seriously.
Oh, wow. That sounds scary. How common is it?
Well, it's not as common as asthma or diabetes, but it's common enough. Over 2 million people right now in the United States are living with Hep C.
Whoa, that's a lot of people. How does someone get Hep C?
Well, I'll tell you, the most pervasive way that hepatitis C spreads is through blood transmission. Most of my patients acquired hepatitis C due to the sharing or exchanging of drug paraphernalia, such as needles. Anything that can come into contact with blood can also be contaminated with Hep C too. So sharing something like razor blades for shaving can be risky for acquiring Hep C. Another way Hep C can be transmitted is through sharing a toothbrush or via the use of non-sterile tattooing needles.
I didn't realize you could pass it along through sharing a toothbrush. There's so many ways to catch it.
Oh, there are countless ways. Certainly, healthcare workers has been exposed to Hep C through inadvertent needle sticks. In the past, some people have acquired Hep C from blood transfusions. But now in the U.S., the blood supply that we have for transfusion use is regularly screened for Hep C to avoid some of the problems that I just mentioned.
Okay, so the main way to get it is through blood.
Oh, yes. The populations who are most at risk are communities that use drugs by injection, or people that have contracted HIV. Also, people who have been incarcerated for a significant amount of time in the criminal justice system have a higher risk of having Hep C appear. Also, Hep C can be acquired through sexual transmission, although that is not as likely, it is possible. In particular, everyone born between 1945 and 1965 really should get tested for Hep C. It is also recommended that anyone who has ever injected drugs, had a blood transfusion, or received blood products also get tested.
But does that mean that anyone could be at risk?
Oh, yes, anyone can acquire Hep C. And I do wish there was a vaccine to prevent Hep C. Unfortunately, that's just not the case yet. So it's upon us to be vigilant about protecting ourselves, such as proactively thinking about if we're to use any kind of drugs that are intravenously injected into us, we try to always use sterile injection equipment. There are syringe exchange programs available to us and accessible that can help you by providing you with new supplies, and some even have Hep C testing on site. So thankfully, there are safe and highly effective treatments for Hep C because it's so easily transmissible.
I've learned so much. Thank you. I'm sorry, I didn't mean to interrupt your visit.
Oh, it's okay.
No, it's been no trouble at all. It's an important topic that should be discussed. So, Robert, tell me how you're doing with exercise. We talked about that the last time you were visiting.
Oh, Carla's been making sure I run about 3 times a week. And we're practicing a dance for a special occasion coming up.
That's right. A very special one.
Special? Hold on. No way. Are you two getting married?
Yep.
Yes, we are.
Oh, hey, that's beautiful. Oh, congratulations.
Thank you.
Thank you so much.